Hi, this is Grayce, and welcome to Thrive with Grayce. I'm very excited to talk about a topic that I myself am not 100% familiar with, but it is something that we're hearing a lot in the news lately about marijuana use and also the epidemic of opiates. And now that it is after election, there are a lot of states, including California, that allow the recreational use of marijuana. So with us today, we actually have Dr. Constance Scharrf, and she is the Director of Addiction Research for the Cliffside Malibu Addiction Treatment Center. And she's also an author. And welcome to the show.
Thank you so much for having me.
Oh, my pleasure. Now, it is a very busy day for me.
I'm sure.
After the day of election. And I was telling you a little bit about what I want to share with our listeners on the program. One thing is tell people what you do, and then we can touch a little bit more what I would like for you to share with our listeners.
Sure. So I am Cliffside Malibu's Director of Addiction Research. And we don't do primary research on people who come to the treatment center, which is, people are afraid, that's my job. Mm-hmm. What I actually do is comb through stacks of medical research that comes from psychology, biomedicine, complementary and alternative medicine, neuroscience, and other fields to find therapies that are useful in the treatment of substance abuse or addiction and other mental health issues. And then we apply those in a clinical setting.
Oh, wow. And I also know that you take a holistic approach to it. Can you explain to our listeners what that means?
Sure. So our understanding of addiction actually has been changing quite radically in the last 4 or 5 years because of new breakthroughs, particularly in neuroscience, in brain research. Mm-hmm. And what we're coming to understand is that addiction changes the structure and the function of the brain in ways we didn't realize before. So what we do at Cliffside Malibu, in addition to intensive one-on-one psychotherapy, right, you need to understand why you needed to use substances in the first place. In addition to that, we use a whole host of complementary practices, complementary therapies, mm-hmm. to actually change the brain in positive ways.
Can you give an example of some of those methods that you use, the alternative ones?
Sure. So one of the big therapies that we use, and other treatment centers do as well, mm-hmm. is meditation. Mm-hmm. There has been probably a pile of research 3 or 4 feet high, if you printed it all out, mm-hmm. that shows that certain types of meditation, particularly mindfulness meditation, is the kind of meditation that has had the most research done on it, mm-hmm. actually grows new gray matter in the brain.
Wow.
And so what we have learned, what we know from neuroscience is there's an adage, what fires together wires together. Mm. So the more you get your brain firing in a certain way, that part of your brain actually grows physically stronger or more connected. Mm. And so meditation actually grows new brain material, which is terribly useful in the treatment of addiction.
Huh. And you mentioned particularly mindful meditation. What does that entail exactly?
So mindfulness meditation, it's a combination of ideas. First, there's meditation, right, which is a contemplative practice, mm-hmm. a centering practice. And then mindfulness is an awareness of the present moment. So it's putting those two ideas together. So one of the ideas, for example, in mindfulness meditation is that you notice when you sit down to meditate, you notice that all these thoughts come rushing in. And instead of engaging them or trying to block them out or counting, a certain number or focusing on a candle or whatever, you just notice those thoughts as they drift by. And it's actually quite profound because you think, wow, like my brain is really busy.
Mm-hmm.
It's processing all this, most of it garbage,
yes.
And so that's part of that process. And it grounds us. What it does for the addict is it grounds us in the moment. It says, wow, I'm here. Everything's okay. I'm not using. I don't have to use in this moment. And so it helps us to break up some of that propensity toward relapse.
Fascinating. That's wonderful. I'm glad that's something that is working. Now, I don't know in your center, but I know in a lot of places in New York City, there's a huge epidemic with opiates addiction specifically. And I personally had someone who died because of an overdose with opiates a year and a half ago. So, it hits home the severity of it.
Sure.
So what's going on? Because I'm trying to understand it myself. I mean, what's your experience? I mean, is it truly an epidemic, or is it something that's been happening and we just are becoming more aware of it?
No, it's truly an epidemic. There's been a radical shift in the last 15, 16 years, basically, since late 1990s, 2000. We have seen at our treatment center, we probably get... we always had a high number of people who were using opioids. It was, a fairly popular drug of choice, but now it's at least 90% of our population uses opioids. It's rivaling alcohol in terms of treatment. Alcohol's always been and still is the number one substance of abuse for this population in our nation, but opioids are coming up fast, and the troubling aspect of opioids is that they are so deadly. They are immediately deadly, right? If you're an alcoholic, unless you get behind a motor vehicle or fall off a cliff while you're drunk, right? You're going to live probably a very long time. Opioids, that's not the case. Opioids, people can overdose and die very quickly. And, we're seeing over 40,000 opioid deaths a year now in this country, which is something that really is unprecedented. And
from your experience, is it easier for an addict that's addicted to opiates, or is it more challenging for them to try and get help?
Well, I think that the issue really is access to care.
Okay.
Right? Because there are treatment centers all over the nation, but they are, most heavily concentrated in urban areas. And insurance may or may not cover them. And even when insurance covers treatment, it's usually for an insufficient duration for the person to get better. So remember at the beginning of this, I said we're trying to change the structure of the brain. That's what we're trying to do in treatment, along with the psychotherapy, getting at the root causes. Well, I can't do that in 28 or 30 days.
Absolutely. Yep.
You don't change the brain in 28 days. So, but if that's what your insurance pays for, you have already been set up for failure. And so that's really what we see as one of the most troubling aspects of substance abuse treatment is that people, really have insufficient access to quality care.
Yes. And one of the things that today with the election is that California has been allowed to use recreational marijuana in other states as well. And also Florida finally said it's okay to use medicinal marijuana as well.
Correct.
So how does that affect, if at all, what you're doing?
So we're in addiction treatment, and marijuana is now 10 times stronger than it was in the 1960s and 70s when it became a more popular substance of abuse in the United States. Mm-hmm. And it really is now an addictive substance. We do treat people for marijuana addiction. Mm-hmm. We also treat people for alcohol addiction too. So it's not the legality of the substance that is the issue. Right. Whether it's legal or illegal really doesn't make any difference in addiction treatment. One of the things that really stunned me, and I think a lot of other addiction treatment professionals, is that in the states where marijuana is legal for medicinal use, right? Because we've only seen a couple of states up to this point, mm-hmm. Notably Colorado and Washington were the first two to go, legalized for recreational use. Right. But in states where medicinal use, which is roughly half the states in the country, mm-hmm. and the District of Columbia, we've seen a 25% decrease in opioid overdose deaths. Hmm. So of that 40,000 people, right, mm-hmm. we could save, roughly 10,000 by making marijuana legal for medicinal purposes. So why is that? I mean, that's the big question for me. Mm-hmm. Why does that happen? And what we think, and it's been too short of a time. There's no good research on this. Right. But what we think is that when people have a less deadly option for pain treatment, they'll take it. Mm. Because people see, you've had someone overdose and die. I've had that. Mm-hmm. This is a problem that really touches everybody, yes. In the country. And so what we see is that people say, you know what? Marijuana has an analgesic effect, a pain-killing effect. Mm-hmm. Let me try that first. Right. And we think that's what's happening, and it saves a lot of lives. Saves a lot of lives.
It's important to mention that because I think we can get stuck on, what's legal, like you said, whether it's legal or not, that's not the issue. It's important to realize that a lot of people who are addicted to opiates start because they are in pain.
Right. And one of the main places to get a prescription is from a doctor or dentist. Mm-hmm. The other place to get access to an opioid medication is from a friend or relative or stealing it out of a medicine cabinet. And most people who do that, especially getting it from a friend or relative, are doing that because they're in pain. And it's so expensive and difficult to go to the doctor, right? Yep. I just had a blood test, and I got a bill for $1,200.
It's ridiculous.
For a blood test.
I know.
I was like, you got to be kidding me. Yeah. So, if you know that grandma has a pain medication and you've, really done, you've been out playing tag, football with your buddies and you've really done a number on your ankle or your knee or whatever, it's so tempting and it's so much easier to just go to grandma and say, hey, can I have a few of those extra pills?
Right, yeah.
And that's how people get started. I can't tell you the number of people who've gotten started on an opioid addiction from routine dental procedures, where dentists, they give you a script for a month. Like, they'll just write that stuff out, and I had a dental procedure done, and I probably needed one, possibly two pills. Right. But I got a script for a month. Yeah. So we really have to look at that and say, what are our options? Because that's how we got into this trouble in the first place, is that pharmaceutical companies went to doctors and said, we know you don't want your patients to be in pain. We don't want them to be in pain. And guess what? We have something completely safe to give them. That wasn't true. And the safe part wasn't true. Right. And so now we have to find safe alternatives. And it's looking like marijuana might be one of those alternatives. It's hard for us to say because marijuana federally is still a Schedule I drug, which means that my colleagues who are interested in researching it still cannot legally do that. It is a tremendous difficulty for us.
So it's really hard to get the information that you need in order to save lives and understand what your true options are.
Correct.
That's got to be frustrating.
Oh, absolutely.
Oh,
absolutely.
But do you feel that things are changing? You know, what do you see happening in the future with recovery and the tools that you can use to help addicts?
Well, I think that one of the things that's going to change and is going to help us in addiction treatment is that we are going to find alternatives to opioids that are frankly more effective, because opioids don't actually work as well as people would like them to. And that's a big prevention tool. You know, I also am hoping that we're going to see alternative pain medications that are less deadly, because the devastation of opioid abuse is that people die so quickly. And remember I said that people don't have access to quality care, or they don't have it for a long enough duration. The most likely time for someone to overdose and die is directly following treatment for opioid abuse. Because what happens is they come into the treatment center, they have an incomplete course of treatment because they can't afford to stay long enough for the treatment really to take hold. They go back out and they overdose because their body is no longer used to consuming the drugs in the quantities that they're used to taking, and they overdose and die. It is the most critical problem we have for people who are released early from treatment. And there's not a lot we can do. And so that really is, you know, to find pain management tools that are less deadly, so that if someone does relapse, I can bring them back to treatment, right? Yeah. As opposed to you relapse and die, there's nothing I can do.
That's something that if anyone's listening right now that knows someone or yourself are struggling, what do you recommend? What do you tell this person? What should they do?
I think the most important thing, especially if you're struggling or a loved one is struggling with opioid abuse, is that they need care, right? They need treatment. It's not something that people generally are going to kick on their own. And that's because the brain changes to make that almost impossible. You know, if you work out regularly, right? If you lift weights or if you run or whatever you do, and then for some reason you can't do that, right? You kind of feel icky about it, right? You're like, oh my gosh, I wish I could work out, but you know, you're on a plane or you're sick or whatever. Now imagine that I pour, you know, an opioid on top of that. The brain won't let you do that. So people really need treatment, and you need to get the best care that you can afford, which really means looking at your insurance and calling your insurance and having someone advocate for the addict, because the addict is not going to be able to do that for themselves. The other thing that I am so supportive of is everybody who has anyone in their household who even uses opioids on a regular basis, forget abuse, even uses opioids on a regular basis, which I define as more than 1 week in duration, needs to have naloxone on hand and know how to use it. And everybody who comes into that house needs to know where it is. It needs to be in your purse, in your glove compartment, in your medicine cabinet. It needs to be everywhere because it saves lives. Naloxone is the opioid overdose reverse drug.
Okay, I was going to ask you.
Right. So it basically reverses an opioid overdose long enough for a person to get to emergency medical care. And it's not to be taken lightly. It doesn't just you don't just get this drug and it's all happy and, I saved myself. It's one of the most horrifying medical experiences a person can go through because it drops all the opioids right out of your brain. I mean, and the person just it's brutal physically to go through that. But when something's brutal physically to go through like that, it very often gets people into treatment too. So, but have it on hand because if you don't have it, you can't use it.
Wow. I did not know this. Thank you so much for sharing that with us because I had no idea that there was even such a thing. So
yes, and a lot of pharmacies, depending on where you are, no longer require a prescription for that you can just go in and buy it.
Oh, okay. Well, that's great. And we're running out of time, but if there's anything else that you would like to share with us, and also give your contact information, maybe someone might be listening and feels that they want to reach out to you, give them that information as well.
Sure. So our website is cliffsidemalibu.com, and I can be reached through that, or any of our, intake advisors can be reached through that. What I'd want to say to anyone who's struggling with substance abuse or really frustrated with a loved one or employee who's struggling with substance abuse is to say that there really is hope. We have treatment methods now that at our clinic have a 70% success rate. It is not like the olden days where you just had to tough it out and maybe 5 to 8% of people recovered. There are tools available, and there is so much hope. You just have to seek that treatment.
Oh, thank you so much. And also, again, if I know you've written some books, so maybe we'll have you back again. You could talk more about what else you do, because I really enjoy what you're saying in the sense that you're educating people and empowering them and allowing them to understand the importance of really basically taking care of yourself. You mentioned, your insurance. People have to start looking at what they covers them, in times of need, or their family and loved ones. We don't really think about that until something happens, and then we start looking at our insurance policy and what it covers or doesn't cover. So being proactive, just in case, you never know, maybe someone in your family might have an issue, or you yourself in the future, at least you're aware of it. And I think awareness is very important in anything.
Agreed.
Thank you so much for taking the time for doing this interview.
Thank you for having me.
Take care.
Bye-bye.
Hi everyone, this is Grayce, and it's time to thrive. I hope everyone's doing well this week, and I'm very excited because we have a guest that I'm getting to know for the first time. She's the first time on the show, and she is a vet, an animal vet, but she's also a holistic, integrated medical counselor. And Dr. Tiffany Margolin is an entrepreneur and professional speaker as well. So she has a very diverse career, and we're going to talk a little bit about everything that she does. Before we did the show, she said this is her passion, and that's what the show is all about. It's about sharing your passion and your gifts with others. So, Dr. Tiffany Margolin, welcome to the show.
Thank you so much for having me. It's a thrill to be here.
So tell us a little bit about you and how you got to where you are right now.
Well, the journey was interesting. So I came from a very Western medical, sort of skeptical background where my sister is an oncologist, a very good Western one. My aunt is a general practitioner, and my father was a highly skeptical medic. So I grew up with a very Western approach to medicine, and I really was the one in the family that loved animals and wanted to participate in their healing. So as I became a veterinarian through, again, the Western channels in UC Davis, I learned that as I went along in my career that there was this wall that you hit, and that is that basically when animals or people get towards the later phases into what we would consider now a hospice situation, they're literally being propped up with, in our world, steroids or antibiotics or non-steroidal anti-inflammatories, and all of those things have very negative impacts on the body. And at the same time as I was coming to this conclusion, I was studying avian medicine, which is highly geared towards nutrition and prevention. Okay. And my sister was diagnosed with ovarian cancer. So everything was hitting at the same time. And all of a sudden, my studies were so intense and my sister's diagnosis was so scary that I actually went through an adrenal burnout. They didn't know what it was at the time. I was literally taken to the hospital twice in an ambulance from my work in the same year. You know, it was crazy. Wow. And they were searching and searching, and I wasn't the one with the cancer. So they couldn't find out what was wrong. And by the end of all the tests and the cardiac tests and the this and the that, they handed me a couple of bottles. Basically, they were Xanax and blood pressure reducing meds and said, well, there you go on your merry way. And I was just like, this is ridiculous. This is like a slippery slope, and there's no diagnosis. And so I began a search for holistic approaches, and between my search, which revealed a lot of nutritional healing, and my search for an acupuncturist and Chinese medical doctors, my sister also affected some massive healing through this modalities. And so then, and then what happened ultimately is I brought all of the modalities I was learning I brought to the animals. And then they'd bounce through the animals to their people, and I began doing a practice of this medicine for both animals and their people. So that's where it goes.
Wow. You mentioned that you had like a adrenal kind of breakdown. What were your symptoms like, just for anyone that might be experiencing this and may not even know that they're...
Yes, actually very common among women, by the way, because even though women think that we're just so equal and can do all the same work as the men in the workplace, our bodies are highly attuned and intuitive and actually are not equipped for the same degree of mental stress. And so the cortisol that we secrete in these stress times where we're just doing everything, plus we tend to come home and take care of the home too, right? We don't recharge. So what happens ultimately as your cortisol gets burned out and your adrenal gland gets tapped is you feel the fatigue. The people start to think they're sick or they have chronic fatigue syndrome. Hormones start being affected. Most of these women, including myself, have some functional thyroid problem, and it doesn't always mean that your thyroid levels are low, but rather your receptors are desensitizing, as well as your insulin receptors. You get insulin resistance and stuff. So you get blood sugar drops and you get dizziness. I had dizziness. I had some vertigo. I had fatigue. I was shaking. There were times when I would sit up my head in bed and I'd be shaking. I thought I was having like a Parkinsonian episode. It was crazy. Palpitations. It's all hormonally based because the adrenal gland is directly linked to your thyroid and then your estrogen metabolism. So all of that is linked together.
Wow. And so you started acupuncture and like nutritional, sort of looking at what your intake was, your diet, supplements?
Yeah, so the first thing I actually looked at, and I think it's a very good idea for anybody to look at, and probably the quickest thing, is to look at your nutrition and look at actual sensitivities. And it's easy to find that out using someone who can help you with muscle testing. So a lot of chiropractors know how to do that, some acupuncturists, and you can first and foremost find out what's going to make your body weak in terms of what you're eating, whether it's gluten or, in my case, I was sensitive to tomatoes. Certain B vitamins are actually not good for everybody. And when you find that out, if you take those out of your diet right away, you're immediately going to stop stressing your system quite as much right away. That's the first thing that can be done. And then going to, away, most of the time it's just a natural common sense thing to take away the simple refined sugar, because that just drops your blood sugar so quickly after you eat it, once you've taken it in. So those are ways to immediately reduce adrenal stress. One of the fun things that I found out about from a medical doctor who had become a biochemist and integrative doctor, he said, for your adrenal glands, he said, you don't really need this supplement or that supplement. What you need is sunshine in the morning to hit your pineal gland, to hit your forehead, hit your head, not through a window, getting outside, fresh air, and sleep. And, most of these people need to institute naps or some form of regenerating some of their lost hours of sleep. For about 6 months to a year, you have to be really diligent about getting a certain amount of sleep. It doesn't have to be perfect, but much better than most of us do,
Right, because I think most of us don't sleep very well,
We may, and that is a function. So it's that that endless circle feedback system where your sleep has been affected by the adrenal imbalance, but then the adrenal imbalance needs sleep too. So the best reset is to start by getting up actually a little earlier in the morning and getting into the sunshine, and maybe just taking a half an hour walk very gently, because that is what I began to do, because I couldn't do my workouts. I couldn't do anything that I had used. And so as you do that gentle initiation in the morning, your pineal gland and your pituitary, all of those reset. And so by the evening, you actually feel more tired than you have been feeling, and you should put yourself to bed. And the ideal time, they say, is between 9 and 10 p.m. So
wow. I'm learning a lot, because I think I try not to take naps. and I know I've had people tell me, if your body's asking for rest, then perhaps you should rest. But I'm like, no, I have things to do. And I think a lot of people feel this way. They feel guilty and trying to get rest.
I understand, but the thing about that is actually what will keep setting you on high alert. So what happens is, when you keep saying, if you can take a nap, if you keep saying no to your body when it says I need to rest, you're telling it that it's not okay to rest.
Right.
And it's speaking directly to your nervous system. So that actually sets up your nervous system so that the next time you feel the need to rest, you may just shoot out some adrenaline, and now you're going to start tapping your adrenal gland without realizing it, because your adrenal response to being tired is just going to be to ignore that. So you need to be careful with that if you want to help yourself.
Oh,
so,
fantastic.
And 20 minutes is really all you need. You're not going to need an hour and a half now.
Right. But I think it's wonderful that you're mentioning that, because I do get a lot of people writing to me, and particularly women, and they feel guilty. I could be doing this instead of taking a nap.
I guess if you try to realize that, more and more, I'm happy that more women are actually taking care of themselves, though, and realizing that if you're guilty at this end, you're going to feel really guilty when you can't do anything at all 10 years sooner than you should. Really, if 45 and 50 or even younger, you can't raise a finger because you're so exhausted, and you have some weird diagnosis that puts you into bed and gives you a disability so you can't work, you're going to feel really guilty. So how about balancing that thought with that?
Great point.
It's preventative maintenance, yeah.
Absolutely. So now you started incorporating what you've learned for yourself. And how's your sister, by the way?
So my sister was diagnosed with stage 4, and she had 3 kinds of cancer. And it was, they told her she didn't have more than a few months, and she actually had 5 years of wonderful, superior health. And then she went into this arena where she always wanted to play with baking. And so she went into baking, and you're not supposed to eat sugar, especially high amounts of sugar, when you have cancer in your body, because cancer loves sugar. And my sister chose that she wanted to enjoy some part of her life. And so she went into the sugar pretty heavily. And after about a year, the cancer returned, and she succumbed to it. But, she knew what her decisions were. And I feel like your conscious decisions are better, and you can make your choices. So I really don't have any regrets for her. I feel like she made her choices very consciously. So.
Oh, okay. Well, I'm sorry for the loss, but it sounds like you said that she had a full life. She made a conscious decision to live her life the way she wanted to.
She did, and she had an amazing time doing it. So.
And that's all we can ask for, really.
Right.
And so then you started utilizing your experience with your animal patients, right?
Yes, I certainly did. So immediately, I started working first with chiropractic and nutrition, and it's funny because birds, almost all of their problems are nutritional. And so I started correcting their vitamin D levels, their sunshine, their nutrition, and then I realized, well, these dogs and these cats, they're eating out of cans and bags, and this was before the advent of all this great, these great homemade and raw diets was out there. So I started implementing some of those changes, getting them out of the grains and such. And then at the same time, I was able to take acupuncture and develop Chinese medical techniques and start working on them with the acupuncture at the same time. So it was really nice.
Oh, that's wonderful. And what was your experience? How did they respond?
Oh my gosh, it was so funny. Well, thanks for asking, because I too was a skeptic, right? Because I came from that same family. So you're always arguing with yourself.
Right.
But what's great is I can do the scientific method to prove things to myself. So I would bring my needles, and I was just beginning, and I would bring my needles, and I'd say, look, I don't know if this is going to help your pet or not.
Right.
So I would put some needles in and feeling like an idiot and not being completely sure. And every one of them reported a positive result. And I was just like, I couldn't believe it. I still had to recheck and say, what are you seeing? And it was everything from the animal was walking better to that they felt better to that they were like smiling more. It was really funny. Like they're playing with their ball, or the cat is jumping more again. The rabbits are doing binkies for those rabbit owners out there. So it's really funny. And I actually had experienced it initially with my own dog, but I really didn't link it to the work I was doing because I didn't know I could do it. You know?
Right.
Yeah.
So that's wonderful. And I have a dog. We rescued a dog 4 years ago, and he is a poodle, and he has seizures.
Yep.
And so we're thinking of trying to get an acupuncturist. We were able to minimize his seizures. I mean, when we first got him, he had severe seizures, and he's on medication. But we noticed immediately that the food that they told us to buy, which was, I'm not going to name the brand, but it was high sodium and crap, really. So
right, and crap. That's the ingredient I don't like. I hate when that's on the top of the label.
Yeah, exactly. Just crap in a can.
Yeah. So I prescribe usually no crap diet first.
Right.
For inflammation. I mean, you just have to. Everything is linked down to the tree trunk of inflammation, and then branches from there. And you probably must know that. So inflammatory foods are the first thing to eradicate, and that's hugely helpful even when you're medicating, because the meds can't work past. Plus, thyroid is actually often a component, thyroid levels. And then lastly, when you do the acupuncture, you want to make sure that the person doing it actually has some awareness, because it took me a while to study. The seizures come from different blockages and obstructions, and you have to think about where the root of them is when you're doing Chinese medical diagnoses. And it's not easy. I'm not going to say I'm any expert, but the doctors that can either do pulse diagnosis or they can help with determining the root, and they have some patterns for seizures in some cases. It's hard, though. It takes time and it takes some patience.
Yeah. I mean, but I have to say that it's 4 years we've had him. The first 3 months he had all these seizures. We figured out that we will make our own kibble for him. And we started just giving him just good food, healthy food, and no sodium, as much as low sodium as he could possibly get, because the medication he was getting, the potassium bromide, was, if you have sodium, it cancels out the effects of the medication. So he wasn't really intaking that medication. So I can say that he is a happy dog now. He's much better. Maybe he gets a seizure once a month as to almost every other day.
That's okay, yeah.
Exactly. But, if we can help him out a little bit extra, then we're going to try and see if we could do acupuncture. It's hard because he was a rescue doggy, so we don't know what was his life like before we got him. So
well, right, and anytime you can reduce their general level of anxiety or hypervigilance, you're going to reduce seizure activity, because all it is a kindling and excitation of the brain. So
But he's a happy doggy now.
Yay! We love happy doggies.
Yes,
I think happy doggies are. I do a lot of work with. Certainly with older pets and with their connections with their humans, and I call it, it's the connection that heals, really, and it's transformational. And we're doing a lot of epigenetic work as well, where you're just trying to keep those bad genes turned off with nutrition and supplementation. So when it comes to even seizures, also you want to really look at doing omegas, high levels of proper omegas, because that's extremely healthy for the brain. And I stay away from the fish-based omegas. There's some options out there.
Okay.
I really love the camelina oil omegas now that are out there. They're just really clean plant omegas, but omegas are going to be important for dogs that have seizures or for brain activity.
Wonderful.
Yeah.
Thank you for letting me know, because I'm always trying to find ways that I can help him holistically, because he is a medication, so I want to sort of counter the effects of the medication as much as I can.
Yes. Yes, and you can balance that. That's what the meaning of integrative is, because we're not throwing away the baby with the bathwater.
Right.
Western meds have their place in mitigating some of the conditions that we've bred into our pets. I mean,
yes.
In all honesty, right? So there you go.
And so, what is the reaction with the pet owners? When this kind of treatment, when
I love it.
Yeah.
Well, one of the favorite things is in Chinese medicine, they say that the animals are there to take on and help with the problems with the people. And it's funny because people so often will say, wait a minute, that medication that you just gave my pet is the same one that I'm taking.
Wow.
And so I laugh in a nice way, and I say, well, the truth is that, it's not uncommon for these energies to be similar, vibration and all that. And
interesting.
And so sometimes when I advise on the pets, the beneficial supplements, what the people will do is they'll ask me questions, and I have a certification in integrative nutrition in people for that reason,
right,
so that I can coach them. So
right.
they're getting a coaching as well.
Oh, that's wonderful. That's
Everybody
great.
gets healthier, right?
And animals are so sensitive. They really are. And, I look at my dog. I was working out doing my yoga, and every time I do yoga, there he is. He's on the mat.
He's doing downward dog.
Yeah.
They have to. It's part of the program.
Can you just move a little
and then
bit?
if you have a kitty, they do cat and cow.
Yes, they do. Yes, they do. And, I every time, he's on my mat, and I'm like, you don't need a mat. You've got cushion.
You got paws.
Yeah.
You use your leg as a pillow. I think that's the funniest thing ever, that they use their leg as a pillow.
Yes, exactly. But I look at him and I think, oh my gosh, he brings so much love and joy. He's so sensitive.
Sorry, Beth.
No, go ahead.
I meant to say, that was the inspiration for my book as well, because I've written a book, and it's funny because people say, oh, is it like a nutrition book, or is it is it actually, it's a relationship book, and it's based on and built from my observations, like you, of what they bring to the table.
Right.
And all it's about is looking at how your pet makes you happier, or your spouse, your mate. And how about if you take a few of those tips, wag your tail when they come in the door, be the first one to greet them. You don't have to go so far as licking their face, but certainly sometimes roll over and be submissive, say you're sorry first. And there's some really fun stuff in the book. So
well, tell people about the book, because I want people to know.
Well, people can get the book on Amazon now, I'm proud to say. And it's called Relationship Reset. Get her to love you as much as your dog does. So it sounds like it's for boys, but it's Relationship Reset. And it has a picture of a man and a dog. And I think there's a woman. Actually, we changed it. But it's really lots of small, really simple chapters, simple book, quick read, and really lovely, like a little bedside book for people that really just want to be better at being more loving and having more fun with their people. So.
Oh, wonderful. And anyone that wants to reach out to you, do you have a website or anything that people may know?
Sure. The easiest website is probably drtiffany.com. So it's just my name, DRTIF as in Frank, F as in Frank, ANY.com. And that's the easiest way, because if you go there, you can find me.
Right. Okay. Well, can you believe it? The interview is over, but
No. It's a chat.
It's exactly what it is. The chat. The chat is over. I can't believe it. But thank you so much for taking the time and sharing your passion and your gifts with us.
It was lovely. Thank you.
Take care. Hi, this is the second half of Thrive with Jay Grayce. Of course, I'm Jay Grayce. On our second half of the show, I have with me two guests, which is exciting. We usually just have one at a time, so we're getting a 2-for-1. I have with us authors of The Kooky Adventures of My Friend Kookoobook, and they are brothers, and their names are Jessie and Kevin Howard. Welcome to the show.
Oh, thank you, Jay.
Thank
We're
you
happy
so
to
much.
be here.
Oh, it's my pleasure. Now, your book. What was the inspiration behind it? I want people to know exactly what inspired you guys to do this.
Well, the inspiration actually is twofold. First, it was from a toy that I had as a little boy that was given to me when I had an extended stay in the hospital. It was a little monkey, a stuffed animal named Kookabook. And he helped me through a very difficult time. I was in the hospital for about a month and a half. And my father's friend brought him in for me and told me this wonderful story I was going to help me get better. And I got better, and I bonded with my new friend, and he left an amazing impression on me that when I grew up, I always wanted to use him in stories for children to help them in the same way that he helped me. And a lot of the reason also is because of his name, Kookabook. It's kind of a fun name.
It is.
Fast forward, I never really knew the storyline for him until I started writing social stories for my son, who is the main inspiration for this. My oldest son was diagnosed with autism early on at about 2.5, 3 years old. And after writing a series of social stories to help him through some challenging situations, I looked at my wife and I said, I have the storyline now for my dear friend Kookabook. And because of my son, I was able to bring Kookabook back to life. And now he's here to help others in the same way, I'm hoping, at least, in the same way he helped me when I was a little boy.
Oh, how wonderful.
Wow.
And so, you know, both of you are involved in the book, you brothers. So how did the collaboration work?
These are social stories that are stories that are specific interactions to help prepare kids for those situations, specific situations. And the reason I got my brother involved is because, one, I kind of like him.
That's nice.
Just a little.
He happens to be really smart, and he has such a great background in education and special education, and so much experience in it that I had to use him as a resource. So right now he just found out that I'm using him.
No, I figured that out a while ago.
You did say he was smart, so he figured it out.
Yeah, but the other thing that really endeared me to him is when I approached him with the idea of using social stories with his character. I have to say this. He called me a genius.
Oh.
And,
that's true.
Right away, we bonded even more.
Yeah, you're like, oh, you get it. You get the whole picture.
I tried to take it back, but actually, that is the story, really. And the reason why I called it genius, to be honest, is I have been using social stories in my classroom for 12 years now, I guess, and they're very effective when I use them with children who are struggling with one particular issue. Sharing is what we started with, is obviously a very general one that all children tend to struggle with, and actually a lot of adults.
I was going to say that.
If we're being honest.
Yes.
So, it's an important one. But when he told me about this concept and using this lovable character, Kookabook, for these social stories, and the thing that we did to take it a step further was to add tips and strategies at the end of the story for parents, caregivers, possibly, general ed teachers maybe that don't typically work with as many children with autism, and just any parent actually struggling with these issues. So for me, that kind of put it over the top to the genius level, if we have to use that word again. But yeah,
you
that's where mine is.
On radio, so everyone can listen.
After this, it's not happening again. But that's basically the story of how I got involved.
Oh, how fantastic! Now, and either one of you can answer. The book itself, it's out now, where people can get it in the first place. Where could we find it?
Well, you can find it on our website, www.kookabook.com. And you can either go there and shop, and you can click on Amazon or CreateSpace, or you can go directly to Amazon or CreateSpace and purchase the book directly from them.
And how long has it been out, the book?
I think it was published at the end of August, beginning of September, so it's been a few months.
Okay, and have you got any feedback, the sense of what parents and the kids have to say about it?
Yeah, we had
go ahead.
Go ahead, Jess. No, I was going to say, well, we had a ton of very positive feedback from parents, caregivers, teachers, gen ed teachers as well as special ed teachers. And most importantly, we got some great responses from children who are on the spectrum. And they say to us, they say, hey, Kookabook has autism? And we say, yeah. And they go, wow, I have autism. I'm just like Kookabook. And it becomes somebody that they can relate to and you know, they can bond with and say, hey, Kookabook's my hero, you know.
Right.
And that was really cool, you know. That was something that we had hoped we would get that response, and we did.
That's wonderful. Jess, if you want to add more to it, absolutely you can.
Yeah. The only thing I'd add to that is the other character in our story, Emily, is Kookabook's best friend, and she's neurotypical, and she's actually the narrator of all the stories. So, and the thing with Emily's really truly the hero of the story, because her personality of being so accepting, so kind, so positive and understanding, that's what allows that friendship to really take hold and take place. And she really sees Kookabook as a child, you know, first, before anything else, before worrying about, you know, some of his exaggerated behaviors or responses to things. She still just sees him as a really fun child, and that's what allows her to become friends with him and to have this rewarding, you know, friendship and relationship, which that's all something that, you know, we feel strongly is a message that we all need to think about and, you know, hopefully aspire to have in our lives. So,
absolutely. I mean, there's a lot of, like, as you know, unfortunately, in the media, a lot of bullying, a lot of things that are going on where, you know, people just are not capable, adults and themselves are not able to.
I think... I was going to say, Jay, I think, that's all because people just don't understand. And usually when you don't understand something or just don't fully grasp it, you know, a reaction could be one of being very mean and unkind.
Yes.
And what we're saying here is, hey, you know, we're gonna help you out here. We have some awareness now, and then we're gonna drop a little bit of knowledge on you, and we're gonna model. We're gonna have Emily model what the appropriate, you know, behaviors, these virtues, and what they can do, and show that a very rewarding relationship could take place between two individuals, even if there are some differences going on there and some maybe exaggerated behaviors. And I think that's a message that can be, you know, spread across the board. You know, we talk about embracing our similarities and accepting our differences. Emily exemplifies that. And just as a side note with Emily, the reason we chose her name, you might like this, is that was the first little girl who became friends with my son.
Oh, how wonderful. That's great. That's beautiful.
Yeah.
And the truth of the matter is, you know, like you said, I mean, most people just don't, if they don't understand something, they sometimes become afraid of it. And sometimes maybe their impulse is to be mean about it because they don't know how to react.
That's right.
So,
and especially kids. So if we hit them early on with some early intervention, just like with, you know, we talk about early intervention for kids with special needs. That's so important. Well, I think it's equally important to have early intervention for the neurotypical kids too.
Absolutely.
To teach them these virtues and show them that. What's going to happen, Jay, is they're going to grow up and be adults.
Yes.
Okay.
Yes.
So 1 in 68 right now is diagnosed. You know, children are diagnosed with autism. That means there's going to be 1 in 68 adults with autism. Well, what about the other 67? Are they going to be accepting and kind and ready to take these people with, that are diagnosed with autism into their population, And what we're hoping is yes, and maybe we could set the groundwork for that and the foundation for it.
Yes, and I think it's so important because, unfortunately there are so many children right now that are in the spectrum. And people say that term, but I don't think a lot of people understand it and what it really means. Maybe you can educate some people what that means, and for the caregivers or potential caregivers out there.
Sure. Well, it's a pretty wide spectrum of behaviors or characteristics that would put you on the autism spectrum. But essentially, what it is it's a communication disorder that also leads to usually social struggles and sometimes elevated behaviors. So, but again, I hesitate to. There is no typical example of a child with autism, and actually that's why we chose Kookabook and a monkey-like character to have that character, because we didn't want to choose a particular looking child or a particular gender or
name, name that is. We didn't want to use a regular name, so we thought it would be fun to have a different name on top of the other things that Jessie just mentioned. But
the thing is, in my experience, and I'm sure Kevin obviously feels the same way with my nephew, his son, with autism, these children and these adults, they have tremendous skills. They have tremendous value. They have tremendous intelligence most times. And, I think as teachers, as parents, as friends, we have to be able to be open to finding that in them and letting them show that to us. So that would be my message to people who, I would say, you might see some exaggerated behaviors that at first will make you, hesitate and say, what's going on there? Why is that child so upset? But once you get beyond that and maybe talk to the parent if they're open and, find out a little bit more. And like Kevin was saying, once you know some more, I really think it will open your eyes and you'll be able to see, what a child with autism has to offer or an adult with autism has to offer, which I think is a lot.
And Jessie's right on point there, Jay. Our tagline is always see the child first. Don't worry about all the behaviors and the exaggerated differences and all those other things. There's a little boy or girl in there.
That's right.
And a lot of times what's driving their behavior is the same thing that would be for anybody else. It's just the way they're reacting and maybe displaying their reaction to whatever's going on. And if you remove that and see them, you realize you have a human being right there.
Yes.
And I'll give you a great example. My son is 15 now. He just started high school. He's a freshman. And he wants to get a job to make his own money,
That's pretty cool.
Yeah, I think that's great.
Yeah.
And I think he doesn't realize that his money is actually my money, but he won't tell him. Just kidding.
Vice versa, too, though. That's
But how typical is that for a teenager his age to want to work?
Yeah, I was going to say, I don't think so. I didn't want to go to work. I was told, you need to get a job. I was like, oh, no.
But he wants to do those things, and I'll even go a step further. I know. And even a step further, he wants to go on a date with a girl at his school.
I know, you told me today. I'm so excited.
I know. Well, we just found out recently they had a holiday performance, and he made a special effort to say hi to his friend.
Oh.
I won't say her name. I won't embarrass her, but it is amazing, and we're setting up to have a date that they can go to the movies together.
Oh,
so
wonderful.
with some of his differences, if we want to call it, with his condition and everything else. Hey, there's a little boy in there. There's a real teenager in there who wants to do the same thing that his typical peers are doing.
Sure.
It just might come out a little differently, and that's where the acceptance and the patience all comes into play.
And those are the key
that's
words.
What we're hoping.
Acceptance. I said those are the key words: acceptance and patience. I think people, when they're not aware, like you said, become impatient. They're like, I don't know what this is all about, and I have no time for it. But once you are aware of it, which with your book you're able to do, it's a great gift because I know personally in my life I have several people who are autistic, and adult and young, and they are blessings, and they are pain in the tushies just like everybody else. I see them as what they really are.
Right.
You know?
Right. No, you're so right. Yeah, you're so right.
That's
the idea.
Back in New York in the 80s, I remember, this is before Jessie's time, there was a commercial on TV. I think it was Tony Danza. It says, how do you treat a person with a disability? And the answer was like a person.
Right, exactly.
And that, that carries true to today. There's just a little caveat to that is, because the spectrum is such an anomaly, we really have to kind of, watch ourselves a little bit and make sure that we are a little bit more patient because there might be a processing issue going on, a communication issue.
Sure.
And we live in a microwave society, so we want everything right now.
Yes.
And sometimes we have to just, maybe wait 10, 30 seconds before we get the response that we're expecting. And a lot of people don't have that kind of patience.
Yeah.
So these are the little things that, even though we're going to treat them just like anybody else, that maybe we have to, go a little bit beyond that and be a little bit more understanding to it. And then once we get to that point, then, like I said, with my son working, once he starts making the money, I'm collecting the check.
You're going to retire early.
That's right.
I think that's wonderful. We're running out of time, but I want to let everybody know, where can you get the book again? Do you guys have a website or anything special that you have for people to contact you?
Yeah, you can reach us on our website at kookabook.com. That's KOOKABUK.com. We also have some fun activities on there and a bunch of other things and some previews for our next books that are coming out.
Oh, fun.
And then we have all the reviews of the books on there, and also the menu item to shop, which we think everybody should visit, especially for the holidays. What a great gift it would be to buy a book, and there's no better interaction with your child than sitting down and reading with them.
That's right.
And, this is, even though we have some tips and strategies to empower, and I know you like that word.
Yes, I
empower.
do. I do.
To empower the parents to help facilitate and these interactions and foster the relationships, and that's really on their part. So we're dropping some knowledge on them, but also just to sit down with them and just have a fun read. And this goes across the board to neurotypical kids and families and all that. I think everybody has something they could benefit from and be entertained and have a lot of fun doing it.
I think so, too. I thank you so much, both of you, Jess and Kevin, for doing this, and keep thriving. I want you guys to, next time you have your other book coming up, let us know, and I'd love to share it with everyone else.
Oh, we would love
Absolutely. Thank you so much.
Happy holidays, guys.
Oh, to you too as well. Too. Thank you so much.
Take care.
Take care.
Bye now.
Bye. What a wonderful, full-packed hour of wonderful guests. I want to thank each and every one of you for making this show so great. But I also want to thank you, the listener, for being part of the program. And I want to wish you and yours a very happy and safe new year. See you next year.